president of the bifurcational club is a little bit challenging. Anyway, we have two types of stents. My population consists of 20 patients treated with Axxess, which is a type of bifurcational stent, and 41 patients with Tryton. And if we see why to confront these type of stents, because they're completely different for the bifurcation. Axxess is a self-expandable stent. It's a drug-eluting stent. It covers the carina without putting metal exactly on the carina, so the flow is very smooth toward the side on the main branch. And the other one, the Tryton, is a balloon expandable. It's a practically bare metal stent and covers only the side branch with a very less metal on the main branch. It's something like a kilo, so you need another stent to put on the main branch. Objective of my presentation is to share with friends and with the people who are expert about these two completely different stents in the bifurcation, and to share our first experience, complications, success rate with these two stents. About the population, if you look at the population, our population was really very heavy with the risk factors, almost for the Axxess group, for example, 95% were with hypertension and 80% with diabetes, 70% with dyslipidemia. And in the Tryton group, we don't have diabetes because the diabetic patient has its bare metal stent. To put the bare metal stent in the bifurcation, it's a completely wrong thing, so we don't have this type of patients. And also, if you look here, with more than two risk factors, 95% of the Axxess group, there were more than two risk factors. So, about the clinical characteristic of our patients, we previously seen acute coronary syndrome. In both groups, we have about 50% of patients who were previously treated with angioplasty. And the interesting thing is about the syntax score that before the treatment, before Axxess treatment, in the index procedure, we have 24 points of syntax score, and when we are going to put the Axxess or Tryton, we have 14 points. Why is that? Because, for example, just some cases, for example, this patient, he came to my hospital with myocardial infarction, acute occlusion of the LAD, stenosis on the bifurcation, occlusion of the circumflex artery intermediate branch, chronic occlusion of the right coronary artery. Total syntax score was about 41, and this lady from the Tryton group, occlusion of the right coronary artery, long stenosis on the LAD, and bifurcational stenosis on the circumflex and marginal branch. So with again the 25-point score syntax. So we treat these arteries, and he came, this man with Axxess, came for treatment of the LAD. Once opened the LAD, circumflex, left right coronary, left right coronary. So his syntax score was 16, and the lady had reopening of the right coronary artery, treatment of the LAD, and she came only for the bifurcation. So the syntax score was 11. So this is some type of presentation we do in Italy now, as a poster that you can open. So all the variables about the two type of stents. Radial approach was quite high in the Tryton group, less in the Axxess group for the beginning. Then we started to use, because Axxess needs a bigger catheter, 7-inch catheter, we started to use sheetless catheter, so we can now do Axxess also to the radial approach. The procedural time for the both type of stents are almost equal. The same is for the Eric's time, but the contrast, we use much more contrast in the Axxess group because placing Axxess needs very precise precision, and you use continually contrast to put the Axxess. And about some materials, the wires, the balloons are almost equal in both groups. Cutting balloons use much only cutting balloon for the Tryton group, not for the Axxess group, because the preparation of the side branch is very important. The Tryton is difficult to pass to the side branch, so you have to prepare very well the side branch. So the type of Tryton and Axxess, for Axxess we use much more 40 millimeters, actually, because it's longer. It was first experience, so we do prefer to have a place to open the Axxess at this 40 millimeters to arrive to the point of no return. And here is the total number of the stents we use in the Tryton and Axxess group, which is 1.5 for the Axxess group and 2.2 for the Tryton group. A little bit higher on the Tryton group because in the Tryton you have to put the Tryton plus another stent for the main branch. And here is the results. You can see here the success rate, the total success rate was 100% for both groups. and the device success was about 90 for the Axxess and 92 for the Tryton. Here you can see the good results, and here is some device unsuccess. For example, in this patient, the Tryton, the Axxess went to the side branch and I was not able to pull it back, so I put two absorb stents on the Axxess, and one complication, I had a thrombus here in the Axxess, at the place of the Axxess, balloon, some embolization, but finally resolved good. And the same thing was happening with Tryton, which was after the procedure, I had a occlusion inside of the stent, so Pro, all these things to finish the procedure. And at the end, I have to say that comparison both stents, very high success rate for both of them, complication rate is quite low. They are bulky device, need contrast, need time, need everything to the procedure. And solution for the Axxess is, if it's not optimally placed, you can treat it like a normal stent and resolve the problem. And I have to say at the end of my presentation that these are stents to put when you decide to do two-stent technique. If you decide from the beginning your strategy, provisional stenting is provisional stenting. That's it. And thank you for your attention. And here in this natural bifurcation, that's why I'm a fan of the bifurcations. Thank you. Thank you.
So these cohorts were different in time, I presume, because you had the Axxess before you had the Tryton, so were you using both stents at the same time?
The same thing, both stents.
So how did you choose one or the other?
Well, generally, for example, the selection of Tryton Axxess, first of all, it's diabetes, the risk factors, and second is the side branch, the angle of the side branch. Sometimes you cannot put Axxess because the side branch is quite smooth. So thank you.
Nine,